Hey guys! So this is my career profile number 2, and I decided to focus on a social worker. So an example of an organization would be Banner Medical Gateway Center. And I don't know if this is a hospital anywhere else besides Arizona. So, for example, private hospitals will hire you to be a social worker. And my friend actually just got a job at a hospital in Utah as a social worker. So I didn't know anyone until Wednesday, and that's when she got the job. So that's really exciting for her. So the working environment is large organizations. You have your typical 9 to 5 job, and it includes sometimes one Saturday a month just because you need to be there for your families that are going through a rough situation. And in case anything happens and no one is there to handle the situation in the way that needs to be handled. And the hours can be flexible, but you are needed in the hospital, so it's a preferable 9 to 5 job. You also have freedom in how you want to handle the patient and their circumstances, and it can be really family friendly. Some hospitals have daycares for its workers, which is really cool. Some typical stressors are watching a family or patient go through a rough diagnosis, being able to help guide patients to make the right decision, working with the medical staff, and treating a patient that can't afford their circumstance or the surgery or chemotherapy or whatever they are going through to treat their diagnosis. So the typical benefits are full health benefits because you're working at a hospital, which is really nice. And I think I didn't look anywhere else besides a hospital, but I'm pretty sure you would get full health benefits. You also get a 401k retirement and sometimes there's on-site daycare. And some private hospitals will pay for your school loan, which is really cool. Or I just found out my friend Morgan is getting her master's, I guess, in social work while she's working at the hospital. So they're paying for all of her graduate school, which is really cool. Some common on-job tasks are initial screening and evaluation of patient and family, comprehensive psychosocial assessment of patients, helping patients and family understand the illness and treatment options, helping patients and families adjust to the hospital, helping families adjust to emotional and social responses to the illness and treatment, educating patients on the role of healthcare team members, facilitating decision-making on patient psychosocial issues, and promoting communication and collaboration with the staff and patients. And this is really cool because you feel like you have someone who's there and on call that can listen to you at all times and talk with you and through situations that are happening because doctors are just so busy sometimes, most times. Some of the educational requirements are a bachelor's degree as well as a master's in social work, and sometimes, well, it depends on where you're working. So at the hospital, is required on-job medical training, and just your basic CPR, your basic how to use a defibrillator, what the terms are that they're talking about so you can explain it to your patients and their families, and just to understand the hospital and the way things work a little better. So the starting salary is $48,000 and the experienced salary is $95,000. And that is all I have for you guys today. But if I were to become a social worker, I would definitely work in a hospital. I already like the medical field a lot. I think it's really interesting, and I think this would be a good way to go. Thanks, guys. Have a great evening.